My name is Amanda Whitworth, and I live in Seattle, Washington. And my cancer journey has been a very, very, very long journey.
It feels like every time my life is going in a good direction, something happens like this. Something comes up with my health. They find something in a screening, and then it totally derails me.
About August of 2022, I started just feeling like this fullness in my pelvis. And I was really busy at the time. I'm an artist and I flip furniture for a living. And so I kind of was just like fully engrossed. And then I was moving into the spot that I'm currently in right now. So I had all this stuff going on, plus the grief of losing my stepdad. But I had this like dull, like new pressure in my pelvis. So I was like just kind of keeping tabs on that. And then it was around my birthday, which is September 6th, that it just started feeling like stronger and stronger. It started to feel like I was being like pushed open from the inside of my pelvis. And so I called my oncologist up here.
I'm going to show you something kind of crazy. This is me just comfortably relaxing my stomach. This is not normal.
And so I gave him a call and I was like, I feel like I need to come in and see you. Something just feels off. So I went in and saw him and gave me like a physical exam. And he said he did feel something in there. And so he got me orders for a CT scan. And so in mid-October, I got a CT scan and there was a grapefruit-sized mass in my pelvis.
This is mass growing. And I wonder why I can barely breathe. Because I look like I'm 3 months pregnant.
We got me scheduled for a surgery. I knew I was going to have surgery to remove it. And at that point, I just wanted it out. So I didn't care like honestly what they had to do. I mean, it was like being ripped apart from the inside out, and it was growing really, really fast. I was kind of in and out, but I do remember every time a nurse came in, I was like, is it cancer? Like, what cancer is it? And she's like, your doctor will be in and talk to you, in the morning. And so he came in around 6 a.m., 6 or 7 a.m., and confirmed that most of it was cystic, but there was a small portion down in the base that was cancer. And it was the same cell type, the squamous cell. Initially, I was diagnosed with like an endometrial carcinoma. Later, after they like sent it off to another specialist, it came back as my official diagnosis is called extra ovarian primary peritoneal carcinoma, which is very confusing. So when I went in to see my oncologist, we talked about how, my biggest concern was I had really, really long, beautiful curly hair. And I was like, I really don't want to lose my hair. Like, I'm adamant about that. And I was like, I know a lot of people are not going to understand this, but I feel very strongly about, like, if you got all the cancer, if you feel like you got all the cancer, I just don't want to do chemotherapy. And he's like, well, there is a potential, like, I could put you on one that it lessens your chance of, or most likely won't lose your hair. And I was like, okay, well, if you feel like you can do that, I'll do that. But we were originally just going to see if we could go the radiation route. And it turns out I couldn't do radiation because too much of my previous area that was radiated before would be covered. And it was just too dangerous. That eliminated radiation. So if I chose to, I had to go the chemotherapy route. He presented all of the options for me. And one of the options was I could do a mix of carboplatin and I think it's like Doxil something, and I wouldn't lose my hair. But then he presented me the option I could do a mix of carboplatin and Taxol, and mix it with Keytruda immunotherapy. And there were so many studies coming out showing that like incredible things were happening with this immunotherapy, but I would lose my hair.
Today's the day. Just today. This is how much hair has fallen out. Let's go cut my hair.
I mean, it was a no-brainer for me. Like, he's like, there are studies showing that Keytruda is like bringing your reoccurrence rate down to like next to nothing. And so it was a no-brainer for me, especially having Lynch syndrome and knowing that I have such a high chance of reoccurrence rates and a laundry list of cancers that I can get. But it was a really tough decision, a tough day for me. Let's just say that I knew I was going to do it, but I had to like wrap my head around it. Oh, really? I am in full remission now. I was supposed to do 6 rounds of Keytruda, but it's the generic version. I just don't know how to pronounce it. It starts with the P. And I was supposed to do 6 rounds with my chemotherapy, but my insurance kept denying it. So I actually only did 2 rounds of it with chemotherapy. And so I am doing 2 additional years of immunotherapy now. I seem to be tolerating immunotherapy pretty well. It definitely, like, I would say one piece of advice is like all of the Facebook groups are wonderful and you can find a lot of comfort in there, but you can also find a lot of unnecessary fear. And, just because one person went through something doesn't mean that you're going to go through it. So I try to limit my time in there. If I am experiencing something, like one of the things I do, like I have it right now, like I get pretty bad rashes on my face that looks like acne, but I get it all over my face and my chest after some, like, every therapy is different. I always say it's like a Russian roulette because I never know what I'm going to get afterwards. Like over the summer, I got my whole body head to toe was just covered in like this horrible rash after one session. But that never happened again. I have therapy every 3 weeks. And so I have 1 more year of it. It's still like a 4-hour day because I have to get labs. I meet with my doctor. And then the actual treatment itself is like from the time that they put it up. And the amount of time is only 30 minutes. So it's way different than chemotherapy, which was like a full day at the hospital. But you still have to do all those other little steps too. One of a major side effect is it affects your thyroid.
So my whole life, everybody has been like, oh my God, Amanda, I want your hair so bad. You have the most beautiful hair. I want curly hair so bad. Are you sure about that?
Obviously, like, I'm growing my hair back now. And there's not those kinds of side effects. You still grow your hair back, but one of the ways that it really affects me is fatigue, and like my breathing. It really it can affect your lungs. For me, it does affect my lungs, and so I have to take like a lot more deep, longer breaths, and it's hard. I get winded faster, and I'm actually currently seeing a neurologist because I do think it's affecting I don't know if it's post chemo changes, but there's some things going on with neurologically right now. And I don't know, he doesn't know that it's necessarily from Keytruda, but we're just like crossing all our T's and dotting all our I's right now. So they just go through my port and it's pretty easy. It takes 30 minutes from start to finish. And then, so you're usually in the chair for about a total of an hour, just because sometimes the pharmacy takes a while to get you the medication, but you don't have any, like with chemo, you usually get Benadryl. So I drive myself, and, yeah, it's pretty, usually that afternoon, like I get them in the mornings, and then I come home and sometimes it gives me a little bit of a stomach ache. So I want to stay inside and be close to the bathroom. But other times, like I'll go out in my workshop and work, and like I don't make a lot of plans with people after treatment, but it's every day is a little bit, every session is a little bit different. So I just kind of gauge it off of how I feel. Because I have Lynch syndrome, like Keytruda is linked with like fighting some. I mean, I made a joke. I made a joke when I went in to get my colonoscopy to my gastroenterologist, and I was like, I was thinking, I'm like, hey, if there is like colon cancer, at least I'm on Keytruda already, and like I'm like working against it. So I like to think of it as like there's something else. I'm on this drug that is fighting it and or preventing it. So I mean, I think people don't understand that like there are so many tools if you go through your hospital social worker. It's just not discussed a lot. And so people feel like, oh, I can't get this, so I'm just out of luck. But just talk to your social worker at your hospital. There's usually always something that can be done, or at least they can try to do something. And so my social worker went directly to the company that makes it. And it's all income based. I think my biggest message is like always listen to yourself and push for the things that you feel in your heart that you want, and make sure that your team really listens to you, because that's like they're your team for the long haul. And just because you are going through cancer right now doesn't mean that once you go through treatment and if you go into remission, then it's done. Like you're with them for the long haul. And so you want to be very, very comfortable with them. And my team knows that I like to do a mix of holistic and, Western medicine. And I'm grateful for both. And one of my oncologists said the most amazing things to me. And he's like, there's great things about Western medicine and there's great things about like holistic medicine, and they work really great, like symbiotically together. And I just loved that he said that to me, because I just felt heard. And so just find somebody that makes you feel heard, and just try to live your life. It's the scariest thing you will probably ever go through, but you have to keep finding life in the little moments throughout your day.